I'm here to tell you what osteopathy is and what you can treat with osteopathy. When you come to see an osteopath, they will examine your body as well as possible. They will check if there's any imbalance in the shoulders. They will check your shoulder blades. They will check your pelvis and all the tissues to see if there are any restrictions, if the other side is tighter than the other side. And let's say the patient comes with a knee problem. We can check if the ankle is working like it's supposed to, if the standing posture is good for the lower limbs. We can check if the pelvis has something that would cause some strain on the lower limbs. All in all, we try to see how is the body working as a whole and how it's affecting whatever the issue is. So the most common reason to come and see an osteopath is most likely low back pain. And research says that with osteopathy you can help low back pain, migraines, headaches, different symptoms that you have while pregnant, and then also you can treat babies with osteopathy. Research also tells that with preterm babies you can lessen the time that they spend in the hospital if they get an osteopathic treatment. What osteopathy is then? Well, osteopathy is a manual therapy. It's a healthcare profession which is regulated here in Finland by Valvira. We treat people with our hands, which means it's a manual treatment. The goal of the treatment is to balance the system so that it can heal itself. In practice, that means that we're gonna try to get all the stresses out of the system, maybe do some soft tissue work, get the joints moving as they are supposed to, and get the fluids flowing. With fluids, we mean blood flow and lymphatic flow, for example. So we palpate the tissues, we palpate your body to see if there are any parts that doesn't move as well, if there is any hardness on the tissues, if there is any silence in the tissues, which means that there is no motion. And that will give us a lot of knowledge of what's going on in your system. We can also check the breathing. Is the diaphragm working like it's supposed to? We can see if the breathing seems too shallow, if it goes all the way to your shoulders, that will cause some strain on your shoulders, and we don't want that. So we get a lot of information of your body just by examining it with our hands.
I was actually patient myself first before I started to study osteopathy. I had a painful back and I happened to see my friend who had just graduated as an osteopath. He started to treat my painful back with very light and gentle and relaxing techniques. It was something about 10 minutes and he asked me to change position on the table to turn on my side, and I remember that the pain had already left my back, so I was a bit surprised that how did this happen and what did you do? And that was actually the first moment when I became interested in osteopathy and the possibilities of treating this way.
How did I get to be an osteopath? I started practicing Ashtanga yoga 13 years ago, and I got chronic shoulder pain from practicing too hard. I went to the physiotherapist and massagist first, and the pain didn't go away. So I got recommended from my teacher to see an osteopath, and when I went there, I got really confused for the soft techniques and osteopath's ability to diagnose and feel the different kind of physiological process in my body. After treatment, the pain did fade away and I decided to study osteopathy.
The beauty in osteopathy for me is the fact that we can do so much with so little. We don't have to force the body to do anything, but we can work with it with very gentle motion, with very gentle techniques, and we can help it to heal itself.